When the leaders from the world's wealthiest nations met at the G7 summit in England's Cornwall over the weekend, they announced a vaccine sharing initiative that would see 1 billion shots spread across the world. Now it is up to aid and advocacy groups to overcome vaccine hesitancy. Voice of America brings you this report.
Weekend, leaders have pledged over 1 billion doses.
That is the promise from the world's wealthiest countries to help some of the world's poorest countries combat COVID-19. The number falls well short of the 11 billion vaccine doses that Oxfam says is needed, calling the G7 summit a failure.
The G7 had a huge opportunity to actually deliver a global roadmap towards fully vaccinating the world. What we've seen is warm words and very little action.
Eloise Todd is co-founder of the Pandemic Action Network. She says numerous hurdles exist to get those billion doses into arms.
There's kind of 3 prongs really to the vaccine strategy, which is procurement, buying the vaccines, delivery, getting them to a place where you can get them in people's arms, not only on the tarmac in the country, but do you have the healthcare workers, the community workers to be able to do that? And then crucially, willingness to receive the vaccine.
Outreach programs to vaccinate communities in developing countries revolve around trusted endorsements from leaders, influencers, and health workers.
If the health workers at the local level, who the communities trust, right, have actually seen that, have communicated that, listen, I'm taking care of it, I'm taking the vaccines because I trust the science, I trust the efficacy. That itself is reinforcing the belief in the vaccines.
Edwin Ikuoria is Africa Executive Director for the One campaign. He says as more people get vaccinated, hesitancy will drop.
People become ambassadors because the fear is that if you take it, you will die. If you take it, you will be sterilized. If you take it, all kinds of things. So when people who have taken the vaccines also come out to talk about the benefits of how their life is going back to normal, how they are not afraid, how they are also living healthier and all of that, they become a part of the whole program of getting others who are not to come on board.
The experts say success overcoming hesitancy in developing countries ultimately depends on having enough vaccines and enough people to administer them. Arash Arabasadi, VOA News.